My name is Lennox Huang. I'm the Chief Medical Officer and a pediatrician at the Hospital for Sick Children in Toronto. The thing that worries me the most about coronavirus in children is the amount of misinformation that's out there. I'm going to try and answer some of the more common questions that I hear about coronavirus infections in children. So are kids more susceptible to the coronavirus than adults? Well, we really don't know. What we do know is that there are almost no documented cases of children having coronavirus infections. So I've had some people ask me, how dangerous is the coronavirus compared to the flu in kids? And I have to tell you that the flu is far more dangerous. Every year, thousands of Canadians die from the flu. Right now, we have 5 Canadians affected with coronavirus, and none of them are children. So what might be the defense against the coronavirus or other respiratory viruses? One of the things that I start teaching children at a very early age is how to wash their hands. And it's something simple you can do at home. You can even sing a song, like Twinkle Twinkle Little Star, as the child washes their hands. Also important to teach children to cover their mouths and noses when they sneeze or cough. These are basic, simple hand hygiene and respiratory preventative measures that can help prevent the spread of things like coronavirus or other infections. Do children need to wear a mask to school? Well, masks are really great at keeping viruses in, but not so great at keeping viruses out. Wearing a mask is not going to keep your child from getting a cold or the coronavirus, and it's not part of our recommended measures to prevent spread of viral infections. So how should you talk to your child about coronavirus? Well, there's a few things to remember. The first is that your children have already heard about it. They're already talking about it. And I think it's important to balance being honest and clear with being a point of reassurance for your child. Kids can read the feelings of their parents. They know when a parent is anxious. And the fact is, the risk of coronavirus for Canadians remains low. Another thing to consider is that children may be asking questions about where it comes from, who's affected, what do they look like. I think it's important to tell your child that just because an infection may have started in China, it's not an excuse to stigmatize anybody at school.